I'm Dr. Sally and welcome to Orchard Barn, and I've been asked to do another post about vitamin D, and I know that many of you are interested in this. It's certainly been something I've been interested in for a long time, and I just want to, I can go through some guidelines and tell you a little bit more about how important vitamin D is for the body, and we'll also happy to answer questions. If you want to ask, always post any questions on the Facebook page or on Instagram. So I'm sure many of you are aware of how important vitamin D is for our health, particularly our immune system, and it's really vital for the immune system. There's some really interesting studies which link vitamin D as having a protective effect against viral infections and respiratory illness. So there's some nice studies showing that it can help with that. We know it has a really important effect on the immunity. It's also very important for strengthening bones and for keeping strong bones and teeth. For our mood, it's important. It helps to protect against cancer. And regulates insulin in the body, so it's important for insulin and sugar regulation, so therefore may help to prevent diabetes. It's also very important for healthy pregnancy. So there's lots of studies looking at how important vitamin D is in pregnancy, and reduced or vitamin D deficiency has been linked to diabetes in pregnancy, increased risk of bacterial and vaginal infections, an actual increased risk of cesarean section has been shown in some studies. And preeclampsia, which is and also preterm delivery. So it's really important. It's also been linked to an increased risk for the baby of having brittle bones or reduced calcium, and actually even allergies. It's actually been vitamin D deficiency has been linked to an increased risk of allergies for infants in the first 2 years of life if the mother is deficient. So you can see it's really important for so many parts of our health. And in this country, we tend to be deficient, basically because it comes from the sunlight, and particularly in the winter months, we just don't have the correct exposure to be able to make it. So it's important that we take supplementation. So basically, you can only absorb vitamin D between March and September. So in the winter, you really don't get any, you can't really make it at all. And it's important that you are out every day, expose arms and lower legs for a short period of time. We don't know exactly how long, but short periods of times daily seems to be the best advice. If you've obviously got darker skin, it's going to be harder to make vitamin D, so you're more at risk of deficiency. And obviously for children, because and infants, particularly babies, we don't particularly want them to be exposed to bright sunlight because it's damaging their sensitive skin. It's really important that they take supplementation too. So ideally, I recommend people to get their vitamin D levels checked, because otherwise you are kind of guessing with knowing how much you may need, and it's surprising the levels of deficiency that people are walking around with, to be honest. When I do test, we offer a finger prick test in the Orchard Barn shop, which you can buy, and it's basically done by a lab in Birmingham. One of the hospitals there runs an external pathology service and has this vitamin D test, which you send back to the lab in Birmingham. They email you the results, usually within a week. And then you've got, then what dose to have and be more accurate. Otherwise, the recommendations for dosing are, so any breastfed babies need to supplement with vitamin D, because bottle-fed babies, often vitamin D is included in the formulas. So, but breastfed babies do need to have a supplementation. Children between 1 and 4, certainly also to help protect against rickets and for their bones. And really any adult who is not going to be outside enough, particularly in the winter. So generally I recommend everybody through the winter to take it. In the summer, if you're outside a lot, say for example you work outside, or you're doing a lot of exercise outside, you probably would be fine. If you're working in an office or you're inside or have particular dark skin, then you would maybe need to take supplements through the summer as well. I generally recommend for children for babies 400 IU a day, up to from age 1 to 18 that increases to 600 IU a day. For adults, my maintenance dose is generally 1,000 a day, but I do often have to supplement higher than that because people are deficient. So I often go up to sort of 3,000 or 6,000 a day for short periods of time to boost up levels. And the data that we have on toxicity shows that really probably up to 10,000 a day is safe. So vitamin D can be toxic in large doses. It tends to cause increase of calcium in the blood and in the body, but like I say, the doses, you do need to run pretty high with those doses for long periods of time. But it is going back to why I recommend getting tested is really ideal. So we can the stores in our bodies can be run down quite easily. So that's why through the winter, particularly at the end of a winter, our levels tend to be low, and this may be a reason why people tend to start getting more kind of coughs and colds and things like that, really, because vitamin D is so important for our immune system. We can get some from food, so oily fish has got some vitamin D, so cod liver oil is another source of vitamin D, and eggs and dairy produce you can get vitamin D from as well. Some mushrooms are fortified with vitamin D or have vitamin D in them. Generally, we don't absorb it too well from food. Sunlight is the best way, but it's always worth, you can put those things into your diet and that will help. So hope that's been useful, and take care.